This model describes the screening and triaging process for COVID-19 cases using the screen, isolate, and notify approach. At the end of this model, you should be able to describe the screen, isolate, and notify approach for the screening and triaging of COVID-19 cases. Describe the requirements for setting up a triage station and system at a healthcare facility. Describe the requirements for proper isolation of patients, and describe the appropriate authorities to be notified of a suspected COVID-19 case. All patients entering a healthcare facility during the COVID-19 outbreak period must be safely screened using the case definitions for COVID-19. Patients suspected of having COVID-19 should be isolated from other patients, and the appropriate authorities should be notified. This process is referred to as the screen, isolate, and notify approach. Screening for suspected COVID-19 cases. The following steps are required to facilitate the early identification of cases of suspected COVID-19 infection. A well-equipped triage station should be established at the entrance or entry point of healthcare facilities supported by trained staff. Healthcare workers should maintain a high level of clinical suspicion. The use of screening questionnaires, according to the updated case definitions, should be instituted at healthcare facilities, and a screening register to record clinical symptoms and relevant exposure of patients should also be maintained at healthcare facilities. Patients are to be screened using the COVID-19 case definition for suspected cases. If a patient does not meet the case definition for a suspected case of COVID-19, then the patient should continue to access routine care in the healthcare facility with standard precautions applied at all times. During screening and triaging, ensure the following. Healthcare workers should maintain a distance of at least 1 meter from patients at all times and wear appropriate PPE. Clear signage for symptoms of COVID-19 and triage algorithm should be provided. Family members should wait outside the triage area to prevent overcrowding. The waiting room chairs for patients should be 1 meter apart. A one-way flow should be maintained for patients and staff. Ensure to provide clear signage for directions. Patients should be observed for respiratory symptoms. If a patient is coughing or sneezing but is not a suspected case, fast-track patient for consultation and teach respiratory hygiene or cough etiquette. Give a mask to the patient for use. If a patient is coughing or sneezing and is a suspected case, give a mask to the patient for use and move the patient to an isolation room or area immediately. And ensure patients perform hand hygiene after sneezing or coughing. The following materials are needed for triage. The triage area should be well defined. Screening questionnaires based on the COVID-19 case definition. Signage showing triage algorithm and COVID-19 symptoms. Screening register. PPE for healthcare workers, which includes surgical mask, hand gloves, and gown. Disposable tissue and face mask for patients. Hand hygiene equipment and hand hygiene posters. Infrared thermometer. Waste bins. Cleaning and disinfection materials. And signage for direction. Isolation of suspected cases. If a patient meets the case definition for a suspected case of COVID-19, the patient should immediately be moved to a well-ventilated isolation or holding room or area for further evaluation. Once the patient is isolated, arrangements should be made immediately to notify the appropriate authorities and collect samples for laboratory confirmation. When moving patients, Healthcare workers should ensure to wear the appropriate PPE and maintain at least 1 meter distance from the patient. Once the patient is in isolation, the healthcare worker should explain reasons for isolation or holding and ensure the patient understands by repeating the reasons. Explain the necessary IPC procedures or precautions to prevent transmission to the family, healthcare workers, and the community. Educate the patient on respiratory hygiene and cough etiquette. Give the patient a medical mask and make sure the patient understands how to use it. And, if possible, collect samples from the patient for testing. If sample collection is available at the healthcare facility, notify the appropriate authorities and collect a sample from the patient using the appropriate PPE. The appropriate PPE for sample collection are gloves, N95 respirator, gown, and goggles or face shield. If sample collection is not possible, notify the appropriate authorities. After sample collection, arrange for the commencement of further care if need be, or for the transportation to a designated COVID-19 treatment center. Isolation rooms should be created at the healthcare facility to isolate suspected patients or hold suspected patients pending transfer to an isolation facility. If specific isolation rooms are not available, place the patient in a single, well-ventilated room with adjoining toilets. If a single room is not available, place cohort patients in a specific confined isolation area. Rope off or put a border around the area to prevent entry by non-essential personnel. There should be at least 1 meter or 3 feet distance between patient beds. Ensure that the isolation room or area is well ventilated with windows open to the outside and doors closed. Do not use fans. The following are important IPC precautions that should be implemented for the isolation room or area. Restrict or limit access to the isolation room and assign dedicated healthcare workers to the room. Staff should not move freely between the isolation areas and other clinical areas. Restrict all non-essential persons from isolation areas. Ensure that the isolation room or area is well ventilated with windows open to the outside and doors closed, and adjoining bathroom and toilet facilities. Maintain a register of all persons who enter the isolation area. The register should be placed at the entrance of the room. All visitors and healthcare workers that enter the room must fill their name, address, phone number, time of entry, time of exit, as well as reason for entry. The room must have the appropriate signage, contact and droplet precautions, and have facilities for respiratory hygiene, hand hygiene, and safe waste disposal. During isolation, ensure the following IPC precautions are adhered to. Healthcare workers should always perform hand hygiene and must wear the appropriate PPE at all times, based on risk assessments. The appropriate PPE for moving a patient and entering the isolation room are gloves, face mask, and gown. The appropriate PPE for specimen collection are gloves, N95 respirator, gown, and goggle or face shield. When transporting a patient to the isolation room or area, use predetermined transport routes to minimize exposure for staff, other patients, and visitors, and have the patient use a face mask. Notify the dedicated personnel at the isolation area or room receiving the patient of any necessary precautions as early as possible before the patient's arrival at the isolation room or area. Limit the number of persons, including healthcare workers, who have contact with suspected patients and maintain accurate records of all persons entering the patient's room, including all staff and visitors. Use dedicated medical equipment for care of patients in isolation. All non-dedicated, non-disposable medical equipment used for patient care should be cleaned and disinfected appropriately. Clean stethoscopes with alcohol between patients. Healthcare workers must refrain from adjusting PPE or touching their face while attending to patients. Healthcare workers must adhere to the steps for safely doffing and disposing of PPE after attending to patients and always perform hand hygiene. Ensure that appropriate environmental cleaning and disinfection procedures are followed consistently and correctly. And, once the patient leaves the isolation room, clean the room immediately, paying particular attention to the beds and mattress covers, high-touch surfaces around the patient's bed, toilet, and bathroom. 5,000 ppm chlorine solution should be used to clean body fluids. The following materials should be provided for the isolation or holding area: hand hygiene equipment and posters, personal protective equipment such as gloves, surgical mask, and gown. If samples for laboratory testing are to be collected at the isolation room, N95 mask and goggles or face shield should also be available. Infrared thermometer, contact and droplet precaution posters and signage, waste bins, cleaning and disinfection materials, chairs and table, and register to record entry into isolation room. Notification of the appropriate authorities. Notification is important to ensure patients get the appropriate care needed, facilitate patient transfer to an isolation facility in cases where isolation rooms or wards are not available at the health facility, ensure proper record keeping of identified cases. Make all efforts to reduce the waiting time between first contact with the patient and notification or transfer. Ideally, this should be immediate. The appropriate authority: Local Government Area Disease Surveillance and Notification Officer, State Disease Surveillance and Notification Officer, or State Epidemiologist should be immediately notified about any suspected case of COVID-19. Do not wait for laboratory confirmation before notification. You can also call the NCDC toll-free number, which is 0800 97 000010. Here is a recap of what has been taught so far. Do not turn patients away. Screen and triage all patients. Implement screening for cough, respiratory symptoms, and travel history at entrance to the facility. Provide face mask to persons who sneeze, cough, or show respiratory symptoms. Encourage hand hygiene amongst patients and healthcare workers. Suspected COVID-19 cases must be safely screened, isolated from other patients, and the appropriate authorities must be notified. Protect yourself by implementing distancing rules and using appropriate PPE. The appropriate PPE for moving a patient and entering the isolation room are gloves, face mask, and gown. The appropriate PPE for specimen collection are gloves, N95 respirator, gown, and goggle or face shield.